Good afternoon, everybody. I am Dr. Dilip Kumar Pahari, working as a nephrologist at Medica Super Specialty Hospital, Kolkata. I will be talking on the need for dialysis in chronic kidney disease patients. Chronic kidney disease we usually define when the patient has got some kidney disease for more than 3 months, and the EGFR or estimated GFR is usually less than 60 ml per minute. And the disease often is progressive. So once the progression happens and then eventually the EGFR falls below 15 ml per minute or even less than that, maybe up to say 10 or 5 ml per minute, the patients become symptomatic. Sometimes anorexia, nausea, vomiting, as well as shortness of breath, and maybe there may be edema. So when the symptoms appear with a lower GFR around the range between say 5 to 15 ml per minute, then we start dialysis. So dialysis is now the mainstay of therapy for patients reaching the end stage renal failure or CKD stage 5 when the eGFR is less than 15 ml per minute. So at the moment the government as well as state as well as central government has given some facilities for free dialysis available to majority of patients in our country. So people are now approaching us for more dialysis sessions, and the people have got some longevity in their lifespan has increased over time. So therefore, if you find that this is a valuable addition to the whatever available few years back, we need to monitor the quality of service available. Since we are doing all these procedures, we need to monitor the quality of service in there, and so it should not fall. The second corollary of this program, I think we should compare what the other countries like European or American are doing, is that when they are offering this Medicare or Medicaid help actually to people around this for need for the dialysis, they also offer some cost to the patients who are undergoing kidney transplants. So the transplants and dialysis are two parts of the same thing for a patient who reached the end stage renal failure. So obviously a patient who has reached the end stage renal failure, if his age and physical condition permits, he may either go for dialysis or go for transplants or go for dialysis for few period and then eventually go for transplants. If the government has to support all these finances for the dialysis or transplants, it is better the government should invest some amount of money and infrastructure for encouraging transplants, because transplants is the less expensive procedure and better quality of life for patients rather than on dialysis. So we should encourage patients if they go for uh, kidney transplants, and normally in US, for example, they not only provide all the money for transplants but also provide maintenance immunosuppression for 3 years after transplants. So because compared to that same patient, if he undergoes the only dialysis for the rest of the life, the expenditure is huge. Rather, the expenditure on transplants is much less. So therefore, government is preferring for that, but we have not seen such initiative in our country. I believe that this initiation should happen, and there is a more stringent laws to bring out the cadaver transplants. So the brain dead declaration in all the hospitals should be mandatory, and maybe there are other rules may be changed so that cadaver transplantation takes place in a more efficient way. So, but by and large, like in all other countries, the population for the dialysis is increasing over time, and it is now all the dialysis centers are almost saturated because of the patients accumulates over time. So at the moment what we feel that maintenance of the quality of dialysis is important, and after the initial stage that somebody is getting some form of therapy, we must have some investment on maintaining quality of dialysis. Thank you.